friends who didn't have health insurance and ran into some, including my own sister who had an accident and didn't have health insurance and had to pay health bills in America from here. So that she could actually take time off work and get sort of care. Because if you don't, either you work, or if you don't work, you can't afford care. And there's a bit of a problem. So you get to see how dysfunctional even a system of a very wealthy country can actually be. It is also it can be extremely divisive. It can be extremely divisive. Those of you who followed the healthcare US, the conversation around Obamacare was extremely divisive. Why was it so divisive? It's because you have got so many vested interests. You've got big pharma, pharmaceutical companies, because this is an important and necessary thing. It is easy to make huge profits if you have life-saving drugs, and you are not particularly ethical. You can charge huge amounts for it, and people will have to pay. And you have very spectacular cases of that nature in many countries. It has doctors and healthcare professionals who look at one way of doing things. You have politicians, you have community, you have communities of faith who have different world views about, like, Roe versus Wade, which is quite topical at the moment. So it's an extremely emotive and can be an extremely divisive issue. So what and in this country also we have had our conversations around the health workers and the county government and industrial relations issues, and between private and public, and between curative and preventive, and all sorts of things, and various people. Everybody feels very, very strongly, because healthcare, their health is very, very important. So, building a healthcare system, a good healthcare system, requires a level of coming together that is probably more unusual than many other things. Hence the statement, why I found the statement by the Singaporean foreign minister about combining the three things: healthcare, social capital, and governance. I think because you have to have a lot of social capital so that people can do the give and take that is required for you to arrive at a solution. For the last year and a half or so, we have been involved in having that kind of conversation internally, doing a lot of thinking, going back and forth, consulting various people. And we think that we have framed an outline of a vision of a healthcare system that can work for us and can deal with some of the challenges we are facing, and both in terms of access, in terms of cost, and in terms of the risk that healthcare burden imposes on society. I want to highlight just one issue that I would like us to focus, to use the issue that will focus our minds. As I was looking at the statistics and the performance statistics, I came across this particular indicator. You can find it if you go to the health indicators from the World Bank. I think it's but I found it in the World Bank development indicators that 36% of Kenyan households, 1 out of 3 households, is at the risk of being impoverished by a catastrophic illness costs. 1 out of 3 Kenyans. So by being impoverished, note, means they are not currently poor. There are people sitting in this room. Okay, so we are not talking about people who are already poor. We're talking about people who are impoverished. And I want to give that particular issue a real life experience, because this is an SMS sent to me by someone I knew, and we haven't met for many years, about her situation and looking for assistance. And she said, "Hello, David. I'm reading this SMS. I've been battling breast cancer since last year, January 8. 8 chemos, then a mastectomy on the right side, and I'm now doing radiotherapy. 14 done, 11 to go. But I really thank God for his goodness. Been a long, tedious journey, draining in every aspect, but I'm determined to win." And she puts that sort of emoji there. "I'm totally drained financially. 1.7 million gone and counting." And then she says, "Please, kindly, from your heart's kindness, sponsor me for 1 radio session for 4,400 shillings as I figure my life out, and keep me in your prayers. Regards." I still feel tears when I read this message, because I read it often. I want us to think about this, because this is a thing that will happen to many of us, to many of our families. Not perhaps as a thank, pray, but we know for a fact that someone close to us, someone we care about, will be in this situation. How can we solve this? What can we do about it? And that's why I said this conversation. That's why I said this conversation will transform Kenya. Because if we focus and are able to come out with a way forward for the country on this issue, whatever we do will transform Kenya. Whenever we do it, it will be the one thing that, and I believe Kenya, we have a track record of doing things and setting the pace. And we have set the pace in development in many things. And I believe, I feel the conviction that this is our moment to set pace on one of the most important things that distinguishes human achievement. Thank you very much for listening to me.